pubs. It is not a license to start opening alcohol sale across the country. Alcohol shall only be sold with those having meals in the normal manner in a restaurant. We have not opened bars. Then we have said that when we are in those restaurants, we will not be serving buffet lunches or self-service lunches for obvious reasons. I think anybody will understand that if you are going to go to those restaurants, then there will be no buffet as we understand it, or self-serving food and people walking around and, in the food areas. That cannot happen. Then in terms of the safety within the restaurants, what we expect to see is that, number one, that anybody walking into a restaurant must wash their hands first. They must sanitize themselves. They must have a mask. And more seriously, is that restaurants that are going to open with people who have been tested, who are going to be COVID-free. So if your persons have not been tested, you cannot open a restaurant, because it is very possible then for a person serving there to spread the disease amongst all customers who walk in. And this is from experience. I think some of you know what happened in some of the areas we had quarantine facilities, and some of the people passing the disease, even in those facilities, could very well be those serving the people. So all other measures, running water and what have you, all those measures will be taken to ensure that people are safe in the restaurants. We have also, from an economic, again, to support the economic perspective, the president announced the issue of hygiene workers to clean up all the slum areas, all the populated areas. And this has two purposes. One of them is that we are going to keep people working, particularly young people, the youth in those densely populated areas. But even as they work, again, there's a protocol, there's a health protocol, because anybody walking in, we have asked our team, our public health officers, to be part of those teams, to go with thermal guns and ensure that there is nobody walking with a high temperature, even as they clear the garbage areas, to keep distances when they do so, and all other protocols that have been issued by the ministry. This is all in an attempt to make sure that people keep eating, and people can feed their families, even as this situation escalates. Of course, we will, as the president said, escalate or de-escalate these measures depending on how we see the situation going. By the end of the day, as I have repeated many times, the Kenyan situation will unravel itself because of one single factor, and that is our own self-discipline. If we discipline ourselves, and if we take responsibility at an individual level, then it is quite possible that we can begin to defeat this virus. But if we don't do so, then we will continue to have challenges. And these challenges are going to be very expensive in terms of lives and in terms of the economy. But my hope and prayer is that this is what is going to happen. And I'm glad to say that we have noticed that people have actually begun to adhere to the rules that we are making. And particularly on the hygiene side, what that has done, it has brought down already the cost of healthcare, because cases of diarrhea, cases of stomach problems have gone down dramatically. And we have no doubt that this is because of the hygiene measures that we have taken. So without adding anything more, let me just first invite the PS to say something and move a vote of thanks. And I want to thank all of you most sincerely, and I want to declare that your committee is now active. Thank you.
Yeah, thank you. Thank you very.
Bila shaka mtazamaji, hizo ni picha za moja kwa moja ambaye amekuwa akizungumza ni waziri
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and no one has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the